Welcome back to 26 and 26. Today's trend is doing more with less, cost pressures, and the ROI of quality. Hospitals are entering 2026 facing the steepest financial headwinds in more than a decade. Rising labor costs, supply chain volatility, workforce shortages, increasing regulatory demands, and persistent reimbursement challenges are forcing organizations to scrutinize every dollar. Under these pressures, quality departments are often viewed as cost centers rather than strategic assets, putting them at risk of downsizing or consolidation, especially when leaders cannot clearly articulate the value equation behind improvement work. As margins tighten, quality leaders must translate their work into strategic and financial terms, shaping the narrative before someone else does it for them. The ability to demonstrate the return on investment or the ROI of quality has shifted from an aspirational skill to an operational imperative. So, what this means for hospitals? For hospital leaders, especially quality and clinical directors, financial literacy is now a form of professional advocacy. Quality professionals are no longer seen solely as guardians of safety, they are essential partners in organizational financial survival. Their ability to quantify the fiscal benefits of better care strengthens their influence in executive and board level decision making. Quality improvement drives outcomes that often extend beyond what can be easily captured on a spreadsheet. Sustained and structured improvement efforts, such as data driven learning, structured problem solving, and multidisciplinary teamwork, contribute to reduced staff burnout and turnover through improved workflows and collaboration, contributes to greater patient trust and satisfaction, to fewer safety events and avoidable readmissions, to stronger relationships between frontline staff and leadership, and to reduced waste, variation, and inefficiency that silently erode margins. Hospitals that understand and can communicate these impacts are better positioned to safeguard both mission and margin. So, what are some of the key risks and mitigation strategies that we know of? Risk number one, limited financial and strategic fluency among quality leaders. When quality teams cannot translate clinical outcomes into cost, capacity, and value terms, their programs risk being deprioritized or defunded. So, what are some mitigation strategies for that? Elevate financial literacy within quality teams. Integrate cost awareness, value-based care concepts, and ROI storytelling into professional development. Risk number two, quality remains siloed as a department instead of a strategic capability. Quality often operates apart from finance, operations, and workforce planning, preventing leaders from seeing improvement as a driver of organizational performance. How do we mitigate that? We do it by reframing quality as a cross-organizational capability. Build structures that embed improvement into every part of the value chain. Risk number three, short-term cuts that undermine safety and long-term stability. We can mitigate that through cost avoidance models and value impact analyses to justify maintaining our core quality infrastructure. Finally, risk number four, there's a misalignment between clinical metrics and payer incentives. We mitigate that by aligning dashboards and scorecards with CMS, our commercial payer, and value-based purchasing requirements. So what are some opportunities for action then? Hospitals can strengthen both quality and financial performance by intentionally linking improvement to emerging value-based models. The CMS Transforming Episode Accountability Model, or the TEAM model, provides a timely opportunity to connect high-quality care with financial accountability across surgical episodes. There's other opportunities. We can build cross-functional partnerships between quality, finance, and operations. We can prioritize improvement efforts that reduce costly variation. We can create standardized ROI reporting for quality initiatives across the organization. We can use real-time dashboards to surface the financial implications of variation. Finally, we can apply a structured framework to target our high-impact areas. Finally, quality and finance don't compete. They complete each other. When improvement and stewardship move in sync, hospitals protect what matters most: their people, their patients, and their purpose. Thanks for joining us.